أستاذ قلب الأطفال في كليه القصر العيني. عايزة أعرف الكاتيجوريز بتاعكم، يعني أنتوا هاوس أوفيسرز ولا نيولي جراديويت ولا ميكتشرز أوف بوث ولا في حد بيشتغل بيدياتريك؟ أوكي مش عدد كبير بقى. في حد بيشتغل بيدياتريك كارديولوجي؟ بيدياتريك اي سي يو، بيدياتريك نيوناتولوجي او نيوناتولوجي. اوكي برضه very few. طيب pediatric cardiology is very specialized branch. Pediatric cardiac emergencies is much more specialized branch. So I will give you a very basic information. You have to start with the basics. Maybe my basics is hard for you, so we can assess. This is the basic for pediatric cardiology, not the basic for pediatrician, so it's higher than pediatrician, and not the basic for ICU, so it's higher than the ICU. Okay? And I don't like the one-way lectures, so I'm going to make it very organized, interactive. Cardiac emergencies for children or infants are totally different than adults. And you have to keep in mind that children are not young adults. The sole problem, almost the only problem for adults to come with cardiac emergency is what? Myocardial infarction, which is very, very rare in the pediatric age group. We have much more important things than this, and much more serious life-threatening conditions than this. Okay? I will skip these points of the electrical properties of the cardiac muscles from the action potential. This is very basic physiology, so most of you must have known this. I just would like you to remember that the cardiac muscle doesn't have tetanus within Rahmat Rabbin, because if the cardiac muscle has tetanus, this will oppose the main function of the heart, which is pump contractility, or the pump is to pump blood. The next important point that I have to remember that calcium is an important element for the cardiac functions. يبقى أول حاجة no tetanus. Calcium is important electrolyte, and we have to remember that the metabolism of the heart is oxidative, so it doesn't depend on the anaerobic metabolism. That's why hypoxia is very serious to the heart. Okay? And رابع حاجة عايزاكم تفتكروها إن الفانكشن of the heart is to pump. This is the main function of the heart through the cardiac cycle, which is, of course, you know, systole, diastole, including atrial contraction, isovolemic and azovolemic contractions and relaxation. You all know that cardiac output is the sum of stroke volume and the heart rate. هنعرف ليه أهمية الكلام ده كله when we go in the cardiac emergencies. Factors affecting the cardiac output are three elements. What are they? Preload, contractility, afterload. Any interference with these three parameters will interfere with the end result of the cardiac functions, and you have to remember this carefully for later on. Of course, all of you know the Starling law is the length of the muscle, which is the preload here, is proportional to the end diastolic volume, and end diastolic volume بيعتمد عليه في الآخر الstroke volume اللي بيعتمد عليه cardiac output. So it's one side. Right. What are the cardiac emergencies that you know, or that you can see in children? What? Heart failure. This is the most common cardiac emergency that we can see every day in the ER. When you are attending the ER, you can see congestive heart failure. This is the most common. What is the second most common? Cardiogenic shock, yes, it's one of the cardiac emergencies, but it's not as common as the second part, which is the duct-dependent congenital heart disease. Duct-dependent congenital heart disease usually leads to cardiogenic shock. Hypercyanotic spells are one of the cardiac emergency, cardiac arrhythmias, and cardiac tamponade. Acute pulmonary hypertensive crisis, and this is not usually to be seen in regular ER. Usually it is in the post-operative patients, unless the patient are neglected or something long story. Or syncope, one of the most important cardiac emergencies, and of course post-cardiac problem have certain emergencies that we can meet with. So, how do you know that you are dealing with the cardiac problem in the emergency? Vital signs. What else? History. Okay? History is very important. Most of patients, they come with a history that they have cardiac patient, but this is not the usual if before the 6 months of life. Usually before the 6 months of life, they are not, most of the patients, they are not diagnosed yet. So how you can know that you are dealing with a cardiac problem? What are the symptoms that you can take from the history and suggest that you have a cardiac problem? Dyspnea, cyanosis. Yes, this is very important. There are certain symptoms that is not related to the heart, but it is really related to the heart because of secondary effects. If the patient is dyspneic and tachypneic, he will not be able to feed properly. And the main problem that will face the mother that he cannot feed well. Or he is failing to thrive. It means that the growth rate or the weight belt rapidly in the first 2 months, usually they grow rapidly. We will find that the patient does not put weight. Okay? So these are important symptoms that we have to keep ourselves thinking of a cardiac problem. What are the cardiac problems that can lead to ER presentations? They are either congenital or acquired. Acquired, there can be different categories from cardiomyopathy, myocarditis, or arrhythmias, all types of arrhythmias. So, here we begin. This is a 2-month male with irritability, poor feeding, fatigues, failing to strive, with fast breathing, no fever or runny nose. Physical examination shows that heart rate is 170, RR is 60, with minimal respiratory distress, galloping rhythm, and breath. So, what's your diagnosis? Congestive heart failure. What else? It's only one differential diagnosis? Wow. What else? What it could be? So what is this? What it could be? Why it is not chest infection, pneumonia? Not necessarily, but this is one. But there's another point important. Minimal respiratory distress. Okay? So this is one of the elements. Sometimes the cardiac patient, they come with not severe respiratory distress as the patient with chest infection or chest problem, but not the rule. You have to understand that there is no rules. There is no rules in medicine. Patient come with a common presentations. Yes, every disease has a common presentation, but sometimes uncommon presentation you can be phased up in the emergency room or anywhere. So this is not the rule, but this suggests that it's more a cardiac problem, okay, not a pulmonary problem. Thus, the patient we mentioned nothing about cyanosis, but this patient is not cyanosis. So does this exclude cardiac problem? No. Does this exclude chest problem? No, because it's grades. It's not cardiac cyanosis only, or cyanosis not only caused by cardiac problems, and not all cardiac lesions can lead